This is Dr. Corey Maas on Looking Your Best. So with facial implants, what we're doing is creating a space on an area that might be weak. Say the chin area or the cheek are two popular areas. Also, the angle of the jaw is an area where a lot of patients are looking for more contour. The beauty of the new preformed implants that are available is that we've gotten past this era where it used to be a little tiny button that we would put at the end of the chin here. Now these implants are designed in what are called anatomical configurations, and I'm showing right now a sizer. This is actually not an actual implant, but a sizer that we can put on somebody when they come in. But these implants are designed so that they contour very nicely to the bone, the underlying bone, which in the case of the chin area is the mandible bone or the chin bone, and that's extended all the way along the side. And you can see that they taper gradually over to the side to virtually no thickness or no augmentation. And in the midline, we can give a variety of thicknesses or distances out from the chin itself. You can see that there's thickness there. And in fact, some of these contours, and again, this is a sizer that I'm showing, can really bring the chin out. In the case of this one, a dramatic squaring of the chin would be achieved. Now these are actual implants here, that ones that we would use. These are ones that have been explanted, washed, and sterilized. I don't use them. You don't use them again. They're used for me as models. But you can see that they're made of a very soft material. I can smash this, and sort of feels soft and softer than rubber. But the beauty is that they come and fill in the geniomandibular sulcus here in the corner, an area that we all lose soft tissue in. It's the end of the marionette line here. So very commonly, if we're doing a lift and someone has a weak chin, I'll use one of these anatomical implants to actually give them a little bit more chin projection and also to fill in the space here where the pre-jowl is. There is a design also where we don't do any augmentation right here in the middle where I'm holding my finger, so it has no thickness here, but on the side there's fullness that comes out along and fills in that what we call pre-jowl sulcus, the pre-jowl dip right here that's evident in most people as we eclipse our 50s. The other types of implants that are commonly used, and again these are sizers and I'm just going to show you some examples, are implants that are really for malar or cheek augmentation. And there's a little notch in them to accommodate for the small nerve that comes out here, a sensory nerve that we have, and we want to avoid that. And this one is specifically designed as a way of augmenting the cheekbone as it comes out to the side here, and also to give a little more fullness to the mid-face of the mid portion of the face. Now this is closer to the traditional cheek implants that used to just sit right here as a little tiny bump on the cheek, but they're designed to be more natural in their contour by designing them in such a way that they lie flat on the bone. And when I place this, I'm going up underneath the lip and creating a perfect space for this to live in, so there's no external scar when I place these. If we look at some of the other designs for this, you can see that many people are spending thousands and thousands of dollars every year or 6 months on mid-face volume enhancement with injectable fillers. Some of these shells, like you can see here, which create mid-face volume, can give long-term mid-face volume. They're contoured to the face. They taper on the sides over here. If I show you the side of this implant, it tapers off to nothing. And so there's no edges or contour changes that can be seen externally, but we're giving mid-face volume correction for the long term, not for a year, not for 6 months, but for as long as we want it. And if we wanted to remove this implant, we could certainly do that. And again, just going through the inside of the mouth, there's a good approach to grasping it and pulling that implant out. So I have a box that I use of different sizers. I'll fit the patient specifically for the size and shape that they need. There are virtually an infinite number of sizes and shapes to these implants. And this is an actual implant, a cheek implant that would be used for malar augmentation. And the other part I can do is simply customize them. I can actually trim these implants when we're placing them so that they're fitted nicely and that they give the right amount of contour but are not too big or too small for the individual patient. If you have any questions about injectable filler materials, or more specifically our discussion point today, these implantable materials, please don't hesitate to contact me, drmaas.com. You can send photographs if you want, and I can morph those images with computer imaging and show you either privately or publicly if you wish to share. those images before and after. And certainly visit my website at maasclinic.com, where we have more written information about facial implants. This is Dr. Corey Maas on Looking Your Best.